In this video, we'll be going over one of the ways in which we can lower the radiation dose in our CAT scanners available in our offices here at Montclair Radiology. Now, typically, on all our CAT scans, we're able to keep radiation dose about 40% lower while keeping the image quality identical to a higher radiation dose scan. There are, however, times when we want to try to go even lower with the radiation dose. And we can do this on all CAT scan images. You're able to lower the radiation dose further, but the trade-off in lowering the dose is you get more noise in the image. The noise is basically areas where there's a lack of information on the picture. So if you're doing a CAT scan of the liver, noise will be areas that look kind of staticky, where there's no good information on the liver, versus signal, which is areas of the picture that are preserved and accurately demonstrate the liver. Now, every image has some amount of noise, and the more noise you have, the less clear the image is, and the harder it might be to make a diagnosis. So the goal, what we try to do, is try to balance the amount of noise and the amount of radiation, and making sure the images remain diagnostic, and with our goal being to keep the radiation dose to an absolute minimum and making our images diagnostic. And one of the features of noise is that the relationship between noise and dose is not exactly linearly correlated. So you can double a radiation dose, but you only get a 30% decrease in the noise. So what exactly is noise? So you can see this picture here is a picture of a bunch of circles of varying sizes and densities, and this is 90% noise. And it looks very staticky because only 10% of the image is made up of the circles that we're trying to view. And 90% is areas of lack of information or noise. As I'm scrolling down through these images, you'll see the circles become more clear. Right now I'm at 50% noise, so half the image is made up of the circles and half is made up of static. And I'm going to scroll all the way down till we get to 0% noise, and you'll see that there's no static involved in this image, and the circles are clear. Even the smallest circle that is the least dense in the bottom left, you can make out, and that's with 0% noise. So there's a trade-off that we try to make a reasonable attempt to keep noise low enough so that we can still make diagnoses, but at the same time keep the radiation as low as possible. So I'm going to show you some examples here. This is a CAT scan, initial CAT scan we took of a chest, utilizing dose reduction techniques that led to a 40% reduction and kept image quality pretty much identical. And it showed that there was a pulmonary nodule in the top of the lung, which you can see in the left side of the image. The patient came back for a follow-up because most people who have CAT scans that demonstrate a pulmonary nodule or a lung nodule have to come back multiple times for CAT scans. So now that I knew that there was a lesion in the lung and I knew the size of the lesion, I knew that I could tolerate some more noise when I took the next CAT scan. So we lowered the radiation dose to a 70% reduction. And the image on the right is showing you this pulmonary nodule on follow-up. And a 70% reduction is a significant savings, and it's clear that there's been no change in the size of this nodule. This is a nodule that's easy to see, and I'm pretty comfortable that on the follow-up after this I can go down to 80% reduction and still make a diagnosis that the nodule is stable. Here's a CAT scan of the kidney showing a stone here, which is that white area, and that's the kidney in the picture. And that was taken with a radiation dose of 157 MAS. And that was the standard 40% reduction that we use on our routine studies. Now the patient came back to follow up the kidney stone later, and knowing that the stone is easily visualized as a bright object in the background of a dark kidney, we can lower the radiation dose. In this case, I reduced the dose a total of 65% and used the radiation dose of only 95 MAS. And you can see that the image might be slightly noisier, but it is easy to evaluate the stone and see that the stone has been unchanged. And again, a 65% reduction is a significant dose savings. Here's another example of a kidney stone where you can see the white stone in the kidney quite clearly here on our initial CAT scan, which was 165 MAS radiation dose with our standard 40% reduction. And then we did a follow-up CAT scan, and knowing that it was a stone follow-up, we were able to reduce the radiation dose to a total of 70% lower with an 86 MAS radiation dose, with again a significant dose reduction. Now these dose reductions are significant particularly because a lot of these patients with lung nodules and kidney stones get multiple follow-ups. And if we can achieve a reduction of 80% radiation, that means you can have 5 CAT scans for the dose equivalent of just one regular CAT scan. And the goal that we have here at Montclair Radiology is to keep the lowest possible radiation dose because we know that's in the best interest of our patients, and we ensure that we're still able to make an accurate diagnosis with diagnostic quality images on all our CAT scanners. And we evaluate each patient on a individual basis and customize each protocol to make sure we have the absolute lowest radiation exposure while keeping image quality diagnostic.